The nation's deadly opiate epidemic is so bad that it's dragging down our average life expectancy, which has dropped 2 years in a row. Latest statistics from the Federal Centers for Disease Control show more than 63,000 overdose deaths last year, 42,000 of them opiate-related. That tops the number of deaths at the height of the AIDS epidemic. Keith Humphreys is a professor of psychiatry and behavioral sciences at Stanford University with a focus on addictive behavior and drug policy. I heard you say, Keith, that you don't even think these numbers have peaked yet.
Unfortunately, no, they haven't. We see this huge rise in the raw numbers, but also if you look at the rate of increase, it's still going up. Fentanyl illustrates that the best. It took from the invention of fentanyl till 2 years ago to get to 10,000 deaths. We added 10,000 more deaths in the last 12 months. So this is far from the worst of it.
Based on your expertise, what is it about the addictive properties of the opiates that it changes your brain chemistry and it's difficult to ever get off of it? And then fentanyl in particular coming across the border, we know that, and also illegally coming in from other places, not just across the border, but coming into the country. Is there any way that you can see right now that you could change the behavior? I mean, that's what you're an expert in that. And I'm curious if you think that's possible. I know that some of these states and localities want to sue the pharmaceutical companies. I don't know what you get from that.
Yeah, so there's more than one problem here. The first is, how do you stop creating new people who are addicted to opioids? And that requires a change in medicine, which is starting to happen but needs to go faster. We need to stop putting people on these medications when they don't need them. There's no reason for a 14-year-old kid, for example, who had an uncomplicated wisdom tooth extraction to walk out of a dentist's office with 30 Vicodin and a promise for a refill, and yet that still happens. So on the preventive side, we need to stop creating new addicted people. Then with those who are addicted, we need to give them high-quality services, give them treatment that will get them out of this very difficult situation they're in, which is harmful to them, but also is very difficult for their families and for the communities in which they live.
What do you think about the lawsuits that the cities and counties there's about 5 or 6, I guess, that are starting to go to court to try to, I guess, get more funding and punish and maybe change behavior? But then are there effective treatments that can help people that are addicted?
Yeah, so I think one way to understand the lawsuits, which are coming from all over the country, cities, states, and counties, is frustration with the political process. In other words, I think a lot of people feel their elected legislators haven't protected them, and the last recourse they have is lawsuits against either the manufacturers or against the distributors. And there have been some, exposures of pretty egregious conduct. Where I'm from, West Virginia, for example, there was a distributor shipping millions of pills to a town with 400 people in it. So there is a lot of misconduct there, and I think that will come out in these various court cases.
Do you think we know that the White House is very focused on this? They've talked about the opiate addiction a lot. Do you think there's any specific thing that they could do that would help the situation?
Yeah, the president has laid the table very well. I mean, he's made important announcements. He gave a great speech. He appointed a commission of very smart people who gave him a lot of good advice. But now's the time for action. In other words, the commission gave good advice on expanding treatment, on using law enforcement differently, on taking action against fentanyl. But now it's time for him and the Congress as well to put it into action. They haven't done that yet, and I very much hope they will. People around the country hope that they will, because we're losing 175 people a day, so we really need to go quickly on this.
It's the people, it's what their families go through, and also we see here that the government estimates that the health care costs and poor job performance is costing Americans $78 billion a year. That's according to the CDC. So obviously we all need to do more. Keith Humphreys, thanks so much for being here today.
Thank you.